everybody, it's Dr. Perry from the Pain Laser Center and StopChasingPain.com coming at you for my morning drive time fit tip. It's Saturday, heading on into the gym to get a little workout action in and do some laser therapy. So, gotta walk the talk, you know. Gotta look the part. Can't ask my clients to do anything I can't do myself. So, what I'm going to talk about today is some really cool information that I came across that I really enjoyed, and I've been familiar with it, but it's nice to see somebody else talk about it. And I came across some information on load vectors, and as a trainer, Brett Contreras, who's really got some great ideas on glute activation and training and stuff like that. So I really want to give him some props out for what I'm going to talk about here, because I've talked about it before about planes of human motion, which is pushing, pulling, rotation, you know, locomotion, and those types of movements, and how it's important to train in all those types of movements. And he talks about vectors, which is kind of the same thing he's talking about. And there's 4 vectors that Brett discusses, and that's axial, which is up and down that you go, kind of like a squat. Then you've got anterior to posterior, front to back, which is like a push-pull type thing. And you got torsional, which is circular, rotational, that we talked about. And then you've got medial lateral. Medial means close to the body, lateral is outside the body, so you go from left to right, right to left. So it's side movements, okay, what they call frontal or coronal plane. And those are very important when you're training, because if you go through all those vectors and planes of movement that I talk about during an exercise, you're going to get a lot more muscle activation, muscle stimulation, metabolic activity, more so than you're going to be just doing one vector. So what I mean by that is that gyms today, you know, they're so loaded with equipment, and people still get hurt when they exercise because, you know, they sit on their ass all day long. They get tight quads, they get tight hip flexors, and you know, weak glutes, no ass. And then they go into the gym and then they sit on equipment and push and pull and do the same damn thing while they're still sitting, and they're only going in one vector usually. And if they step it up and try to go into another vector without getting themselves loosened up or trained right, then they're going to get hurt. So basically, sitting all day, their ass becomes their foot, because they're not standing and moving around like they used to. But if you go into the gym and then you incorporate all these vectors, so instead of getting down and just sitting down and doing a bench press on a machine, you can get into the gym and you can do lots of different movements. I mean, I like the ones where you just can do actually a reverse lunge with a press up overhead. You've got several vectors there. You've got side lateral squats with dumbbell reach acrosses and press ups, and so many different movements you can do with yoga. But the premise I want you to come across with is try to incorporate a lot of movement, a lot of rotation, a lot of turning in a single exercise or during a workout, because you get much more benefit. You don't have to train as much to get as much benefit, so it's about smarter, not harder. And you'll burn more calories, and you'll get a nice lean looking, but more importantly functional working physique that looks good but can actually move good and perform good. There's lots of people that look great but they can't do crap with it. So I see bodybuilders all the time that I put them on a stability ball and their ass falls right off. They don't have any stability or core or rotational stuff. It's all just, you know, basic one movement things. But, you know, I could get on and talk to this for like a half hour, but it's only a fit tip. So I want you to come across from this one, just look into the vectors, you change your movements, do an exercise, and you'll notice a lot more progress and have a lot more fun. Dr. Perry from the Drivetime Fit Tip. We'll see you soon. Have a great day.